Restoration is brought to you by
Hisense, everyday prices for everyday people.
Yes, extra long sanitary pad for extra comfort.
We got yes protection.
Pepsodent, 10 times stronger teeth.
I don't compromise on the quality of my food. Use Tasty Tom enriched tomato mix.
For naturally whiter teeth, Pepsodent Charcoal.
Hello, you're welcome to Restoration with Stacy, and it is a pleasure to come your way this week. And we're brought to you by Kind Courtesy Hisense, everyday prizes for everyday people. Yas Washing Powder and Yas Sanitary Pad, La Palm Royal Beach Hotel, Hooch Corn and Choco Flakes. A very big thank you to Tuwazi Apartments, located at Mile 7, near the Mile 7 Park. And of course, my home away from home, Teflon Suites in Ahojo, Kumasi. If you're visiting Kumasi for business or leisure, make sure Teflon Suites is your ultimate stop anytime you are in Kumasi. And a very big thank you to my glam team, ABS Lux Line, GH Beauty Artistry, Divine Cassie, and Hair Duties.
Yes, baby.
Honey, men wash you why men to take away our.
He's eating out again. Nancy, me trying tasting kuyi.
Tasty
Tom. Add the new seasoning powders about chicken, stew, jollof, shrimp, beef. The way it enhances the natural aroma.
Tasty Tom, dear. I trust them.
And there is no staining of fish, meat, or chicken.
Wait, let me go just sharp.
Me need also.
Tasty Tom seasoning powder. Ooh.
new aroma.
New taste from Tasty Tom, new seasoning powder. Maybe I'm not for anyway. Tasty Tom new seasoning powder. Flavor and taste are fun. This advert is FDA approved.
Remember the days I just couldn't go to the gym because it was that time of the month. Yas extra long sanitary pad took the worry away. Easy.
Yes, comfort. I got yes, confidence. I got yes.
The new Yas Extra Long Sanitary Pad is the joy of every woman. It is extra absorbent and fits perfect. Don't allow anything to hold you back when it's that time.
Wow.
Yes.
Feel confident, stay fresh.
Hi. Is it supposed to be that time of the month? Yes.
I got yes, confidence. I got
Yes.
we got yes, protection. I got
Yas Extra Long Sanitary Pad for extra comfort.
we got yes, protection.
Every child is so unique,
You like no other.
outstanding in every way.
It's me like no other.
So anytime you walk and play,
You like no other.
you are special like Indomie.
It's me like no other.
Did you know that every child on the planet has their own unique fingerprint like no other?
You like no other. I can play the drums. I'm talented. It's me like no other. I can sing. I can dance. You like no other.
As well as their own unique talents and abilities.
I can cook. I can paint. You like no other. Indomie. It's you like no other.
So every day, in whatever you do, remember you are special in your own way, like no other.
Thank you, Mom, for letting me know I'm special and for making me my special Indomie. Thank you, Mommy.
Introducing Indomie beef flavor. Buy now.
This effort is FDA approved.
Ow.
Let me see.
She's never had a toothache before.
There might be a cavity. Don't you use Pepsodent?
We used to, but I'll try the new one.
Ah, that's why.
But doesn't every toothpaste give cavity protection?
Not really. Pepsodent's Cavity Fighter repairs tiny invisible holes to give 10 times stronger teeth. Will you trust Pepsodent?
Definitely. Pepsodent. 10 times stronger teeth.
Use Pepsodent's Cavity Fighter.
Every child is so unique.
You like no other.
Outstanding in every way.
It's me like no other.
So anytime you walk and play,
you like no other.
You are special like Indomie.
It's me like no other.
Did you know that every child on the planet has their own unique fingerprint like no other?
You like no other. I can play the drums. I'm talented. It's me like no other. I can sing. I can dance. You like no other.
As well as their own unique talents and abilities.
I can cook. I can paint. You like no other. Indomie. It's you like no other.
So every day, in whatever you do, remember you are special in your own way, like no other.
Thank you, Mom, for letting me know I'm special and for making me my special Indomie.
Thank you, Mommy.
Introducing Indomie beef flavor. Buy now.
This advert is FDA approved.
Tasty Tom tomato mix. Ofa kakra. Na ye bebre. Fa kakra yang kwani stew dodoa ope.
Tasty Tom dear, it will surely give you value for money. Steak and little is enough to get our desired quantity of stew and soup, and it doesn't color your meat or chicken.
Tasty Tom tomato mix into me handwriting and sada. Into customers bar never.
I don't compromise on the quality of my food. Use Tasty Tom enriched tomato mix. This advert is FDA approved.
Our health is something that we take for granted. I mean, here in our part of the world, we don't really pay peculiar attention to our health. And when we do, it's only when we are sick. And there are also some parts of our body that we should pay attention to that we don't. Trust me when I say that some people have never been to the hospital to check on some vital parts of their body. Okay, so I'm sure some of you are going like, oh, but I check. How many of you go to check on your teeth? Yes, Monsen. How many of you? I'm sure now most of you are feeling guilty. Well, today we're going to have a conversation about toothaches that are unattended. Yes, we'll see where now hospital it can actually give you an issue. And to have this conversation with me today, we have my very own favorite doctor, Dr. Kalsoum Adam. How are you, darling?
Thank you. Fine. Yeah.
I've not seen you in a while.
Yes.
You've been running away from me.
Oh, not at all. You know, I'm always happy to be with you.
I know. It's an honor to have you. You know, it's so funny. Most of us don't go to the dentist to check on our teeth as Ghanaians. All we need is a regular toothpaste and we know we're good. Oral health is not something that is really peculiar to us. If I'm lying, tell me.
That's true.
You're a doctor, but if we have headaches, we'll come. We have stomach pains, we come and everything. But it's really unusual. Yeah, it's just a few people. Let's say on a scale of 1 to 10, I'm not sure we'd even get a 5. Yeah, we wouldn't get a 5.
Maybe even 3. Yes, you're very right.
Yeah. So I want us to talk about it because I didn't even know that toothaches can actually get into something else. And you have the medical term for it.
Yes, Ludwig's angina.
Yes, you're right, doctors. Okay, so tell us about Ludwig's angina.
All right, so I'll start with saying that Ludwig's angina, it's a name, it's a term. So it's made up of Ludwig's and an angina. Ludwig's in the sense that it is a German physician who it was named after.
Okay.
And then the angina, because of how severe it can become, to the extent that it tends to strangle your neck.
Is it?
Yes. So I'll explain how.
Okay.
So if you have a toothache, simple toothache, when you take a tooth and then you take a cross section of it, you have 3 different layers. If you are looking at it from the outside to the inside. So the outermost layer, which when you smile, that's the layer that you see. That's the enamel, the white layer. And then there's a second layer, which is the dentine. And then there's a third layer, which is the pulp. So the enamel usually is very hard and it is mineralized, just like the dentine, which is the second layer. So when you have a cavity, so a cavity is like when the tooth is infected to the extent that there's demineralization of the tooth. So when you have a cavity, it can affect any of these 3 layers.
Okay.
So from the outside, and as it is moving inwards, it becomes more severe.
Okay.
Because the treatments now change. So when you have the cavity affecting the first layer, usually it's painless.
Okay.
So people don't even pay attention. People don't even know that they have a cavity. The only thing that possibly that may make them feel that they have a cavity is maybe when they see it by themselves.
Don't they feel it when they're even brushing their teeth?
Yes, they can feel it when they are brushing their teeth. And then when they see it or when they are chewing, sometimes food catches in those areas and they feel like, okay, maybe there's something there and then I need to have it checked. But then the moment they move to the second layer, which is the dentine, they tend to start having some sensitivity, so hypersensitivity. So anytime you're taking cold foods, warm foods, there's this sharp pain, that you feel. And then that should tell you that it is becoming more severe and it's getting into the dentine layer, which usually has these tubules that are connected to some nerves. Okay. So sometimes with this, people are pushed to come to the hospital for it to be checked. But other times people just ignore it, and then what they do is they do something we call functional shift, where maybe when they feel that short, sharp pain sensation on the left side, now they'll avoid using that
the left and chew on the right.
Exactly, just because of the fact that they don't want to go to the hospital. Then
could it also be that, like sometimes for those of us who grew up with our grandparents, they tell you, we just get some salt water and just try to gargle it and you're going to be fine.
Yes, it could be that it's as a result of that. And then not even just salt water. There are certain things that people use that if I mention here, you'll be shocked. Car battery. The acid from the car battery. Yes, people use it. So it's like when it gets to the third layer, which is where the blood vessels and then the nerves are, that's where the soft part of the tooth is. It tends to become very painful. Very painful to the extent that they can't, it disturbs their sleep. So you could be sleeping and then this painful stimulus now, wakes you up.
It's a biting pain.
Exactly. Very, very painful, excruciating, and then it's lasts for a very long time. Even if there isn't any direct stimulus, such as maybe chewing or whatever. So once it gets to the third layer, which is the pulp, which I have made mention of, it becomes very painful. And if still it is ignored, it is not treated, it means that it is going to continually become infected and affect other surrounding tissues.
Okay.
So then it is going to, because it is an enclosed area. And once you have an infection, bacterial infection, it means that there's going to be something we call inflammation. Inflammation has to do with swelling and all of that. But because it is a very confined area, it can't expand to accommodate the swelling. You get it? So the only way would be that to start looking for other areas to spread to. So once that happens, it starts spreading through the apices of the teeth. So the apices are very small areas where the blood vessels enter the tooth. So it will start spreading through that area. Once it starts spreading through that area, it gets to the bone that is holding or socketing the teeth, and then it gets to the soft tissues or your gums and other things. And then there are other spaces that are just below your jaw or below your tongue. We call that area the floor of the mouth. So that's below the tongue, and you call it medically the sublingual space. Okay, so it can get to the sublingual space, and then it can get to the submandibular spaces as well. So these spaces contain other vital structures like the salivary glands, some of the blood vessels, some of the nerves, it contains all of these. So it can start spreading. And funny enough, what happens is that now the swelling or the accumulation now affects both areas. So your submandibular or bilateral submandibular spaces where I'm touching now, and then directly below your tongue. So it gets swollen. Now once it's swollen, then it would cause elevation of the tongue. So your tongue now becomes bigger. Okay, it's elevated to the extent that it can fall back and then affects your breathing. It compromises your breathing.
Okay.
So the person will not be able to breathe right. So that is why I said the term is Ludwig's angina. So angina is like there's something strangling your neck to the extent that you won't be able to breathe properly, which will compromise your breathing. General health, as well as you won't even be able to swallow. You can't swallow your own saliva. You can't swallow anything.
So it might feel like tonsillitis, having a tonsillitis swell up.
Yes.
Okay.
Yes. Tonsillitis can also lead to the whole Ludwig's angina.
Okay.
But then the commonest cause is untreated toothache.
Okay.
And how it happens is what I have just explained. It goes down, and then now the infection starts to spread to the least resistant areas. Like the bones, where the cortical plates of the bones are very thin. Now it starts spreading, it breaks into those areas, and then it's spreads along the muscle fibers or the fascial spaces, and then you end up having that classic Ludwig's angina. So how they present with is usually they are unable to breathe properly.
Okay.
Okay. So you would see that the tongue is protruding outward.
Okay.
Okay. And then you see that there's swelling, this firm swelling around your sublingual and maybe your submandibular spaces. And then even your neck region as well.
Does it affect the vocal cord?
No. So the vocal cord is down there.
Okay.
So it doesn't affect the vocal cords, but it affects anything above. So your pharyngeal spaces. And then there are times that it can even go to other deeper neck spaces. That is the retropharyngeal space. And then this can go all the way to your heart, the mediastinum. And then it can go to your lungs as well. All of this. So it's like it's pus. So when you get an infection, that's dirty water. Yes. So something like that. So it tends to keep spreading, and then it goes to all these
places.
So
just a common toothache.
Just a common toothache. Just a common toothache that hasn't been treated and has been left for too long a time. And there are other factors that come to play, in the sense that we can talk about the host immunity of the patient. So people who do not have a good immunity, so maybe they have some chronic infection already, or they have some chronic medical conditions like diabetes, uncontrolled diabetes, that can also compound and then make the whole Ludwig's angina much worse. You get it? So there are other host factors. Maybe the person already has some malignancy or some cancer somewhere that has reduced their immunity. Or the person has maybe HIV infection already. You get it? So all of these can also make it much more difficult to treat once you have it. You get it? So there are different ways by which toothache can manifest, but one of them is by Ludwig's angina. That is untreated toothache. And then this can also go on to become something else that we call spreading necrotizing cervical fasciitis.
Oh, jeez.
So
can you break it down?
So that is basically...
I can bet I don't even remember what you just said.
So necrotizing cervical fasciitis.
Okay.
So in this sense, it affects the fascial spaces. So that just below the skin, there's some loose connective tissue, there's some fat there. So the infection goes all the way, and then it affects the within that layer. So then it tends to manifest like burns.
Okay.
In the sense that you would have lost all the skin. That skin is all dead. So you'd have lost a lot of skin around the anterior chest wall, and then sometimes it even goes all the way. If it goes below, it can go and then affect even the skin around your breasts. That's if it goes down, and all the way from your neck, it goes all the way, and then it spreads. So it has to, once you have such toothache that hasn't been treated for a very long time. Yes, these are some of the complications that can happen, and their outcomes can even lead to death. Because there are a number of people who come in that state. It's so difficult. It has become systemic. It's so difficult to treat. You end up becoming septic, and once there's septicemia, it becomes very difficult to treat. And if you are not careful, you end up losing these people. So you can imagine a common toothache leading to your death, when you could have actually done something about it as quickly as possible, and then ended the whole spread of infection. And these patients, when they come, they are very sick. They tend to come in a very sick state, where you may end up having to put them on oxygen to support their breathing. You may end up having to give them some fluids, and that's important because, as I mentioned, once the tank is raised, it becomes difficult to have anything going down. So you can't swallow.
So you keep them hydrated.
Exactly. You can't swallow your own saliva, and then you can't swallow even solids. I mean, liquids and then solids, both of them. You can't swallow any of them. So they tend to come in a very dehydrated state. So once they are dehydrated, it also ends up affecting the kidneys. Then you end up with liver problems and all of this. And you see, it's sad. It saddens my heart because when they come, they would have waited for a very long time at home, started their own remedies at home, and most of these remedies are this herbal preparations.
Because in all honesty, toothache, it's toothache. I mean, it's not malaria. It's toothache.
So herbal preparations. And it's very sad because when you're already sick and you're using these herbal preparations, and you don't have the correct dosage and all of that, it tends to even makes the whole thing worse. Because your liver now becomes much more, your liver function test becomes much more deranged with this infection compounded on it, and then you end up making it very difficult for the doctors to even help treat you and then get you back on your feet. So it's a very simple thing, but it can end up causing
a lot of harm.
Yes, and mortalities as much as possible. So it's important, once you have little cavity in your tooth. As I said, the first layer, you may not feel it. But the only way to catch it is when you are brushing, sometimes take your time. And then look. You can look in the mirror. Once you look in the mirror, you'll be able to tell, oh, there's something here.
Yeah.
Even when you're chewing and you feel that some food tends to pack at some area, there's a possibility that you have a cavity there. And then when you tend to start having some sensitivity or short, sharp pain, you're taking oranges or you're taking anything that contains any citrus components, then you tend to have this kicking
in.
Yes. Please.
That's what I call the biting pain.
Exactly.
Yeah.
So please take your time and then have it checked.
Okay.
It's likely it's also a cavity that has gotten to the second layer, which is the dentine. And once it's in the first and second layer, it's a simple treatment. You don't need to go through any extensive, treatments. It's just you having the cavity cleaned and well prepared, and you put a filling there, and then you're good to go. But then once it gets to the third layer, then that is where
it becomes problematic.
Exactly.
Okay, so we'll take a quick break. When we come back, we'll take our time to look at the causes, the symptoms, and how we can prevent.
Yes.
Okay, all right. So we'll be right back after this break.
Yes, baby.
Honey, men wash you away. Men to take away our back.
He's eating out again. Nancy, me trying tasting kuyi.
Tasty
Tom. Add the new seasoning powders about chicken, stew, jollof, shrimp, beef. The way it enhances the natural aroma.
Tasty Tom, dear.
I trust them. And there is no staining of fish, meat, or chicken. Wait, let me go just sharp. Me need also.
Tasty Tom seasoning powder. Ooh.
New aroma.
New taste from Tasty Tom new seasoning powder. Maybe I not anyway. Tasty Tom new seasoning powder. Flavor and taste are fun. This advert is FDA approved.
I love President Charcoal. Why?
When there are so many other charcoal toothpaste.
That's both charcoal and lemon.
Oh, does it?
Yes. Look right here.
Yes. Pepsodent Charcoal has two of nature's powerful whitening ingredients. With the power of activated charcoal and lemon essence, it removes stains and whitens teeth naturally.
Convinced?
Well, I am. Just look at your beautiful Pepsodent smiles.
For naturally whiter teeth, Pepsodent Charcoal.
Remember the days I just couldn't go to the gym because it was that time of the month? Yas Extra Long Sanitary Pad took the worry away. Easy.
Yes, comfort. I got yes, confidence. I got yes.
The new Yas Extra Long Sanitary Pad is the joy of every woman. It is extra absorbent and fits perfect. Don't allow anything to hold you back when it's that time.
Wow.
Yes.
Feel confident. Stay fresh.
Hi. Is it supposed to be that time of the month?
Yes.
I got yes, confidence. I got
Yes.
we got yes, protection. I got
Yas Extra Long Sanitary Pad for extra comfort.
we got yes, protection.
Let me see.
She's never had a toothache before.
There might be a cavity. Don't you use Pepsodent?
We used to, but I'll try the new one.
Ah, that's why.
But doesn't every toothpaste give cavity protection?
Not really. Pepsodent's Cavity Fighter repairs tiny invisible holes to give 10 times stronger teeth. Will you trust Pepsodent?
Definitely.
Pepsodent, 10 times stronger teeth.
Use Pepsodent's Cavity Fighter.
Every child is so unique.
You like no other.
Outstanding in every way.
It's me like no other.
So anytime you walk and play,
You like no other.
you are special like Indomie.
It's me like no other.
Did you know that every child on the planet has their own unique fingerprint like no other?
You like no other. I can play the drums. I'm talented. It's me like no other. I can sing. I can dance. You like no other.
As well as their own unique talents and abilities.
I can cook. I can paint.
You like no other.
Indomie.
It's you like no other.
So every day, in whatever you do, remember you are special in your own way, like no other.
Thank you, Mom, for letting me know I'm special and for making me my special Indomie. Thank you, Mommy.
Introducing Indomie beef flavor. Buy now.
This advert is FDA approved.
I love President Charcoal. Why?
When there are so many other charcoal toothpaste.
That's both charcoal and lemon.
Oh, does it?
Yes, look right here.
Yes. Pepsodent Charcoal has two of nature's powerful whitening ingredients. With the power of activated charcoal and lemon essence, it removes stains and whitens teeth naturally.
Convinced?
Well, I am. Just look at your beautiful Pepsodent smiles.
For naturally whiter teeth, Pepsodent Charcoal.
This is our Hisense Super Crazy giveaway moment. We're still in Sunyai and I am with Brenda. Brenda, it's the same. So your excitement alone was on another level. Were you surprised to see me?
Yes. Last time I saw you there, but I didn't talk to you.
Now say we're showing your show. And just that's a cash. I found her. Well, we are here to say thank you for the love, the support, and everything. We don't take it for granted. Into Hisense, just like we do on the show. Say yembra na yembeda wasipi pray. Into say baya yaman and sapai Hisense asiyemfa we embra na yenda wasi. So what do you have to say to Hisense?
With the Hisense wasi. I'm coming there. Me use such.
Oh, say papa.
Papa. Me use more bena.
Wow.
No, me use me to kumasi kran sana. Omoba. That's with the Hisense was it.
That's the one I'm going to. More few. No say more Amcon product beer. Or someone who say no so eka Hisense. Ebusunya kuo no ho. Into so who Amcon no who say a Hisense for there. Into ko kruwa now who Amcon who say a Hisense for there. Ne papa no a papa pa. Na we used to swa eche. Mote say Brenda aka inti da wasi baby Brenda. And I look forward to seeing you again. So thank you very much. So this is our winner for this week. Next week we'll come your way with another winner. Well, that is our winner for this week's Hisense Super Crazy giveaway moment. As you are excited about winning or being excited about winning in the future, please remember that toothaches can actually cause issues. I mean, I'm so surprised.
Yes. A lot of people are actually, a lot of people are actually surprised, but it does happen. So
Ludwig's angina.
Yes, Ludwig's angina. Complications of untreated toothache. It's very debilitating.
Okay, so now let's break it down. What are some of the possible causes of toothaches?
Okay. So the most commonest cause of toothache is having a very poor oral hygiene. So having a poor oral hygiene leading to dental caries.
Okay.
So for you to have a cavity, you need certain things to be available. So one, you need the tooth itself. So once you have teeth in your mouth, yes, you're at risk. So you need a tooth in your mouth. Then you need food remnants in your mouth as well. So once you have the substrate, so that's we call the substrate. Then you need bacteria. So if you have poor oral hygiene, it means that you have some bacteria.
Yeah,
still
you harbor some. Yeah,
exactly. So having bacteria, the tooth itself, having food remnants, and then time. So over a period of time, it means that this bacteria is going to act on the food, the remnants of the food around your teeth, and then cause demineralization of your tooth substance. And then this will gradually eat into the tooth substance and then give you a cavity. So once you have all of these 4 conditions present, it means that you are prone to getting a toothache. And people tend not to take their time when they are brushing. They do in fact, 20 seconds is even too long. You know, people don't take their time and then do the 3 minutes, at least 3 minutes brushing. So once you do the 3 minutes brushing, and it's assumed that at least you would have been able to take care of the plaque that forms around your teeth over the period. And it's also recommended that the brushing should be done at least twice a day. So morning and then evening. First thing in the morning and last thing before you go to bed. Some people brush in the evening. Yes, I've brushed. And then the next minute,
there's a craving.
There's something in the mouth, and then they end up sleeping. So
ideally, after you have attended to your craving, you have to brush again.
You have to brush again before you go back. I mean, you go to sleep. So the last thing you do before you go to sleep is you do your brushing. Okay, so that's one main cause. In fact, is the number one cause of you having a cavity within any of your teeth. The other thing would be that the same microorganisms that are within your mouth, they can affect the gums. So something we call periodontitis. So they can affect the gums, and then it can affect the bone that is supporting the teeth as well. So anytime you have your bone or any of the supporting structures of the teeth affected, causing chronic inflammation to the extent that it tends to cause something we call periodontal abscesses. That's the dirty water happening again within micro areas within the teeth, supporting structures. We call it periodontitis. And this periodontitis can also end up giving you what we call the Ludwig's angina. Yes. And then another thing so most of the time, these people tend to have bleeding gums a lot of the times. So bleeding gums. And mind you, once you have bleeding gums, there are so many causes. But the number one cause is you having accumulated plaque over the period. And then the bacteria within the plaque causing irritation to the gums and then giving you the bleeding gums. So some people, when they start brushing a little bit now and then they see blood and they stop brushing. So they would rather be very gentle when they are brushing. But it's different. Once you have bleeding, it means that there's a lot of bacteria within the gums, and you need to brush effectively to remove. It's only when you have taken care of that plant.
Even though it hurts, you have to just endure.
Most of the time, it wouldn't hurt.
It wouldn't hurt.
It's just the redness that people are scared of. So once they see the blood and then it's red, so then they feel that they better not brush I mean, they are a little more gentle when it comes to brushing.
But that is when you have to brush.
When you have to continuously brush.
Okay.
So that whatever that is causing the bleeding gums will be taken away, which is the plaque. Okay. So the other causes of the Ludwig's angina could also be that there's something we call pericoronitis.
Okay.
So pericoronitis is most of the time you have your wisdom teeth being the last teeth to erupt in the mouth. And by the time they are ready to erupt, there's no space at the back for it to erupt. So most people tend to have the gum overlying the crown of the tooth. And then the upper tooth bites on this continuously, causing microabrasions, so causing little sores on top of the gum. And then now you eat every day. So once you are eating, food will get stuck there. Then the bacteria will now start acting on that food remnant. And then that can also cause inflammation or swelling of the gums or the pink flesh that you see when you open your mouth around the tooth. And then that can also lead to an abscess, which can also go track downwards and then lead to giving you the Ludwig's angina. Another could be that when you have tonsillitis leading to tonsil abscesses. So when you have an infection within the tonsils, that can also end up giving you Ludwig's angina if it goes downwards and then it leads to spreading infection in your submandibular space and then your sublingual spaces and then your submental spaces as well. So these are, in a nutshell, these are some of the causes of Ludwig's angina, with the first being untreated and unattended toothache over a long period, leading to the spreading infections. And so it does happen.
Wow. That's scary.
It does happen, it does happen.
What should we look out for? What are the symptoms aside the painful toothaches?
Okay. So the signs and symptoms will depend on exactly the causes which we have spoken about. And then also the fact that you would know from one, you would have had a long-standing toothache that you didn't treat. And you were maybe treating with over-the-counter analgesics or painkillers. And then it goes a little bit and then it comes back. It goes a little bit, it comes back. Some people even go to the extent of using or instilling cotton with acid batteries in the cavity just to kill the nerves. And then, but you see, the main infection is still there. So then they tend to have the pain that goes and comes.
I'm still in shock.
Exactly. Then the other thing that they may present with would be possibly it's giving you a warning sign, just a little swelling, maybe around your jaw.
Okay.
So you have a little swelling, means that it has started spreading, but it hasn't spread to some of these
vital places.
Exactly that we're talking about. So maybe a little swelling around. Another could be that you could have pus coming out of a certain area. So from the swelling, you have some pus. So anytime you feel that there's this dirty water that is coming out of around a particular tooth that has a cavity, and that has a foul smell as well. So that could be one of the symptoms that the patients may have. The other could be that they may just end up, if it's full-blown Ludwig's angina, they may end up with the swelling, which is bilateral. It's here
and there.
Yes. And then also it affects the sublingual, submental space, and then the sublingual space, with your tongue protruding it to the extent that anytime you lie down, you are unable to breathe properly.
Okay.
So you end up having shortness of breath. Anytime you lie supine or you lie flat, you end up having shortness of breath. So that is another thing. And then you may end up with, because of the septicemia, you end up having septic symptoms like high temperatures, inability to eat properly, and then you become sick. You have aches all over. You get it. And then the most prominent would be that you are unable to breathe properly. So most of the time they tend to assume this posture. Because when you assume this posture, at least the tongue is not obstructing your airway. So you are able to
breathe.
Sniff, yes. So we call it the sniffing position.
Okay.
Okay. So it's as though you are sniffing on something that way. So then they tend to have, so that at least the tongue is not lying backwards, so that they can have access to taking some air. So these are some of the symptoms that you may end up having. And then a few signs that I have mentioned, the sniffing position. And then they coming in with high temperatures, they coming in very septic, inability to eat, dehydrated. So dehydrated, the skin texture is not there, sunken eyes, and then, yes, a few other things. And even sometimes, because of the septicemia, they end up going into acute kidney injury. So inability to pass urine. And then it's a whole it's a whole package of signs and symptoms that they may end up with, because it has now become systemic instead of something that was supposed to be just local, and then which you could have taken care of. But then because of the neglect, you end up having all of these happening, and then you become very sick. Yes, very, very sick, to the extent that all of these patients are managed inpatients in the hospital setting. So you would have to admit them, start your preliminary labs, and then you would have to hydrate. So you hydrate. So we've moved on to the treatment, where the first thing you would do is that you would have to take some samples for the labs to check their baseline values. So from your full blood count, which will give you an idea of how the HP is, how much of your white cells, how high your white cells are, which will help you know the extent of the infection, and then your platelets as well. And then you check the kidney functioning. Usually it will be deranged because of the severe dehydration, inability to take in anything. So you do these baseline labs. After doing these baseline labs, the next thing you will do would be that you would want to give them, hydrate them. So you want to hydrate as much as possible, and you check their sugar levels as well. So you hydrate and make sure that at least you would have given them some hydration via an IV line. Then the next thing would be you would have to give them some antibiotics. So you give some preliminary antibiotics or empirical antibiotics. Then you move on to the surgical management. So it's Ludwig's angina is treated surgically.
Okay.
So surgically, what you do is that the first thing you do would be an incision and drainage. So an incision and drainage would be you would have to cut through the region and then drain.
No way.
The blood.
So you cut from here?
Yes. Yes, but it's just a little
incision.
It's not something it will heal.
How many inches?
Oh, should I say not even inches? So maybe about 0.5 to about 1 cm.
Oh, and that's little.
Yes, that's short. So you do your incision and drainage, and your incision and drainage would help you decompress the swelling that is sitting on the airway. So it will help you decompress that, make them at least make breathing,
the airways free,
exactly, patent for them to be able to breathe. Then you move on to, you would have also done some x-rays. The x-ray would help you assess the whole dental, all the teeth within the upper jaw and then the lower jaw. And then it would also help you know exactly the tooth that is causing that is causing the infection. And then you move on to take out that tooth. So that tooth would also be taken out because of the fact
so
that
after the incision.
After the incision, yes, definitely. You have to go through that. And you know, when they come in, because they are unable to open their mouth because of the infection, how extensive the infection is, would have affected other spaces. Sometimes it can go to your masticator space and then cause your inability to open. So the muscles that help open and close the jaw are tensed. They go into spasm. You get it? So we call it trismus. So then you may have to help them open the mouth, there's an instrument that you can use. But all of these is done under anesthesia.
Okay.
So you do this under anesthesia, and then you open the mouth, and then you're able to examine properly the oral cavity, the oral pharynx, and then you are able to tell exactly what the causative factor is. And you take it out. Then these patients are then managed in the on the wards. So they are managed on the wards where after you have taken your baseline investigation, there are some parameters that you check every day. So how what is the consistency of the swelling? Has it reduced? Has the consistency now become softer from firm? Okay, and then have you had some effluent or the discharge? How much discharge have you been able to collect over the 24 hours and all of this? And once they are on the wards and they are being monitored day in and day out for the collection, for the signs of resolution of the infection, you would also want to repeat your labs to be able to tell that, okay, your white cell count has come down. It means that whatever treatment that you are given is working. And if it is going up, it means that there's something else. Then you would have to manage that as well. So all of this is done. And then there are people who come and within a space of 2 weeks they are fine.
They're fine.
And then you can discharge them back home. But then with certain instructions as to how to keep their oral hygiene and how to maintain very good oral hygiene, that's one. And then also to pay attention to their bodies and make sure that in case they feel anything unusual and they are not sure, they quickly come to the hospital for it to be checked before it becomes something else that you can't control that can even lead to their death. So these are some of the things that we look out for, and then we are able to manage some of these cases that come to us. But some become very difficult.
Okay, so how can it be prevented?
Okay, so prevention would basically have to do with, one, making sure that you are brushing properly. To prevent...
Not 30 seconds.
Yes, not 30 seconds. So at least...
And brushing well.
Yes.
Up, down. Or side. So let's... The technique. Let's go through the technique.
So brushing, I always say that it doesn't have to do with the frequency. It has to do with how effective you do the brushing. So you are brushing, one, to be able to remove the plaque that has accumulated over the period. Okay, so it has to
over a 12-hour period.
Over a 12-hour period. So it has to be effective. The moment you brush, after you brush, there's something we call a pellicle that forms around the teeth. So it's just a thin layer that forms around the teeth. But as you move throughout the day, you're eating, you're assaulting your mouth with different kinds of food, water, what have you, different things that can stain the teeth. Then this pellicle starts to mature to become a plaque. And then it ends up picking up these things that we eat, or these things that we assault our mouths with. You get it? So it's important that you take your time and then do the brushing. So how is the technique? So there are different techniques. I know a lot of people like to do up, down, up, down, up, down.
Yeah.
Yes. But imagine you put your teeth together and then you do up, down.
What happens to the sides?
For 20 years. If you do up, down, up, down, up, down, up, down. Mind you, anytime you do up, you're hitting your gum. You do down, you're hitting the lower gum. So if you do this up, down for 20 years, it pushes your gums away. So you tend to expose the of your teeth. So if you expose the necks of your teeth, which are not supposed to be exposed, you tend to have something we call gingival recession. And that can also become sensitivity and then eventually give you other problems that may end up having to be treated in the hospitals. So the up-down is not recommended. The other thing that people do is they do the horizontal, hey, we are going. It's horizontal all the way. You get it? The horizontal movement as well, what it does, over a very long period, it tends to cause craters around the necks of your teeth.
Okay.
So there are people, when they open their mouth, you see that there's this crater or there's this gutter around the necks of your teeth.
Dr. Kalsoum would not kill me. There's a gutter.
So there's this like you would have lost two tissues.
Like slopes.
Yes, it's like a scoop. You've scooped away part of your teeth. So that is also called that is also another form of tooth loss. And if there's this tooth loss, it can also become sensitive over time. If you continually brush in that fashion, it can even end up causing exposure of the pulp, which is the third layer, and then eventually also become infected and then give you all of these problems that we are talking about. So the recommended way is to brush in circles. Okay, so what you do is that you put your teeth together. When you put your teeth together, you have your toothpaste on your toothbrush, and then you start from either the right corner or the left corner, whichever you're comfortable with. Okay, you put it there, and then you start brushing in circles. You are brushing just the teeth surfaces. Okay, so don't be overzealous to the extent that you are brushing and then you go all the way to the gum or the flesh part of your teeth. Okay, so you are brushing just the teeth surfaces in circles as I am doing. Okay, when you get to the midline, you change direction and then you go, and then you get to the other side where you started. So that's the outer surfaces of your teeth. Then for the inner surfaces, you open wide. Once you open wide, then you put your brush at an angle. Okay. Maybe about 45 degrees. And then you sweep outwards. Okay, so this way, and then you are sweeping it out. Okay, so that's how to brush the inner surfaces that are close to either the roof of the mouth or close to the tongue. Then there's another surface, which is where you put your food to crush. So that's the occlusal surfaces. For that, you can do your horizontal brush in that sense. And then you bring out your tongue outwards, and then you brush out from the inner aspect outwards in one direction. Don't do, you are going in and out. No. If you go in and out, what happens is that when you go out, yes, you would have brushed the debris out. But when you go in, you're pushing something back. So you need to just do in one direction in that way. So that's how to do your brushing. And then don't forget flossing. People don't floss their teeth. Yeah. I always say is that if you brush your teeth without flossing, it can be likened to you going to the bathroom, taking a good shower, but leaving your armpits. Imagine.
But some of us over floss. I have a floss in my bag now. Like after every meal, you just want to floss and make sure that there are no food particles in any. Yeah, exactly.
The plaque also tends to accumulate, and you see, the brush bristles are unable for people who usually have very tight ends. The brush bristles are unable to enter in between the teeth. Yeah. So it's important that you do flossing and at least floss once a day. So if you can't do the flossing in the mornings because everybody's in a hurry to go to work, at least in the evening, it's a relaxed time. You can take your time and then do your flossing in between your teeth at the evening times. So this is, in a nutshell, how to correctly brush your teeth. Wow. So we need to avoid, I know a lot of people, it's difficult to start. It's very difficult to start. It doesn't look easy at all. It's very difficult in the beginning that if you want to change a technique that you have been using for, let's say, 10 years now.
I think for now, we will stick to that because nobody wants to go through all the things you have just shared with us. I like to say a very big thank you to you for coming. Don't let me miss you like that.
I would. I'll listen more of it.
Good. So now it's time for you to pick your card. Let's see what you get to take home.
Oh, really?
Yeah.
This was part of it.
Is it? Then you've not been here in a while.
No, I haven't.
Okay, so pick a card for me.
All right.
Okay.
So I hand it over to you.
Thank you for coming. You take home a Hisense toaster.
Oh, wow.
Yes.
Thank you. Thank you so much. I'm really grateful.
You're welcome. So this is from Hisense to you.
Oh, thank you.
And please, let's see you often. Let's see you often.
I will. Thank you, Hisense, and thank you, Stacey.
You're welcome, dear. So a very big thank you to our sponsors, Hisense, Everyday Prizes for Everyday People, Yas Washing Powder, and Yas Sanitary Pad, Hoochcon and Choco Flakes, La Palm Royal, Beach Hotel, Tuwazi Apartments, Teflon Suites, ABS Lux Line, GH Beauty Artistry, Divine Cassie, and of course to all of you wonderful viewers out there. Always do remember, you can do all things through Christ who strengthens you. We'll see you next week.